Ever wondered why your horse may be experiencing a change in appetite or performance? Could it be equine gastric ulcer syndrome? In this video, we will tell you all about it. At the end of the video, we will give you some very effective supplements against ulcers. Equine gastric ulcer syndrome, or EGUS, is a common condition in horses, affecting between 50 and 90% of the equine population. It might surprise you to know that many horses with this condition don't display obvious outward signs and can appear completely healthy. Subtle changes such as a lack of appetite, a dull demeanor, attitude shifts, and a decline in performance could all be indicators of this syndrome. But don't worry, we're here to help you understand this complex condition better. In this video, we'll delve deeper into what exactly equine gastric ulcer syndrome is, how it affects your horse, and how to spot the signs. So sit back, relax, and let's start our journey into the world of equine health together. First, let's understand what gastric ulcers are. Gastric ulcers, also known as stomach ulcers, are sores that form on the stomach lining. They are quite common in horses, with estimates suggesting that between 50 and 90% of horses could have them. The root cause of these ulcers is the horse's own stomach acid. Horses, unlike humans, produce stomach acid 24 hours a day, 7 days a week, regardless of whether they're eating or not. This constant flow of acid is necessary for digestion, particularly in a natural grazing situation. In fact, a horse's stomach can create up to 9 gallons of acidic fluid every day. Now, in a natural grazing environment, this acid is buffered by the horse's diet and saliva. However, when a horse's diet is changed or when it's not able to graze freely, this acid can build up, causing irritation and eventually leading to the formation of ulcers. But here's the crucial part. The stomach of a horse is relatively smaller when compared to other species. This means that the acid has less space to spread out, which can intensify its effects. Furthermore, researchers have found that exercise can increase gastric acid production while simultaneously decreasing blood flow to the gastrointestinal tract. This combination of factors makes horses particularly susceptible to gastric ulcers. So, the formation of gastric ulcers in horses is a complex process. It's influenced by a range of factors, from the horse's diet and living conditions to its exercise routine and natural biological processes. Understanding these factors is key to preventing and treating gastric ulcers. Now that we understand what gastric ulcers are, let's look at how to identify them in your horse. Identifying gastric ulcers in horses can be tricky given their subtle signs. Most horses with gastric ulcers don't show any outward clinical signs and can appear completely healthy. However, if you know what to look for, you can spot the signs and get your horse the help it needs. One of the most common signs of gastric ulcers in horses is a poor appetite. Your horse might not eat as much as it usually does, or it may seem uninterested in its food. This change in eating habits can lead to weight loss, another sign of gastric ulcers. Apart from changes in appetite and weight, horses with gastric ulcers might also show signs of dullness and attitude changes. They might not be as energetic or enthusiastic as they usually are. They might also show a decrease in performance, especially if they are performance horses. They might seem reluctant to train or not perform as well as they usually do. Another sign to look out for is a poor body condition. Your horse might have a poor hair coat or seem to be in poor overall condition. It might also show signs of low-grade colic, which is abdominal pain. This could manifest as discomfort, restlessness, or unusual postures. In more serious cases, horses might show obvious signs of abdominal pain, like rolling or laying down more than usual. They might also grind their teeth, a sign of discomfort. In foals, look out for signs like intermittent colic, reduced nursing, diarrhea, a pot-bellied appearance, and excess salivation. Lastly, if your horse is girthy, meaning it shows discomfort when the girth is tightened, this could also be a sign of gastric ulcers. This is because the ulcers can make the stomach more sensitive to pressure. In short, the signs of gastric ulcers in horses can range from poor appetite and dullness to weight loss and abdominal pain. Each horse is different and signs can vary greatly from one horse to another. That's why it's so important to know your horse well and be able to recognize when something is off. Knowing these signs is crucial in diagnosing and treating your horse early. So, how do veterinarians diagnose gastric ulcers in horses, you might ask? The definitive way to diagnose gastric ulcers in horses is through a process known as gastric endoscopy or gastroscopy. This involves the use of an endoscope, a long, flexible tube with a light and camera at the end, which is inserted through the horse's mouth and down into the stomach. This allows the veterinarian to get a clear view of the stomach lining where they can spot any sores indicating the presence of ulcers. It's a safe and effective procedure that provides immediate results, helping vets identify the problem and start working on a solution without delay. It's important to remember that not all horses show visible signs of ulcers, making gastroscopy an invaluable tool in catching the condition early and preventing further discomfort or complications for the horse. Once diagnosed, a suitable treatment plan can be put in place. Treatment of gastric ulcers in horses has been revolutionized by one particular drug. The star of the show in this case is omeprazole, a medication that has taken the reins in the fight against gastric ulcers. Omeprazole is a proton pump inhibitor. It works by reducing the production of stomach acid, giving the ulcer a chance to heal. It's like turning down the heat under a boiling pot, allowing the water, or in this case the stomach lining, to cool down and repair itself. Now you might wonder why we don't just stop the acid production altogether. Well, a horse's stomach is a bit like a factory that never sleeps, producing acid around the clock to aid digestion. Completely shutting down this factory would be like throwing a wrench in the works. Not ideal. So omeprazole reduces the acid production just enough to allow healing, but not so much as to hinder digestion. Omeprazole is currently the only treatment approved by the US Food and Drug Administration specifically for gastric ulcers in horses. It's available in a paste formulation, making it easy to administer, even to the most stubborn of horses. What makes omeprazole the champion in this race is its effectiveness. It's been shown to be successful in preventing and treating gastric ulceration in all types of horses, from the high-performance racehorse to the beloved family pony. Now, it's important to remember that while omeprazole may be the star player, it's not the whole team. A comprehensive approach to treatment also includes changes to diet and management practices, which we'll cover in more detail in the next scene. And what about the finish line? Well, the prognosis for horses with gastric ulcers is generally good. With proper treatment, most horses can recover fully within 4 weeks. It's like a month-long marathon, but with the right care and attention, our equine friends can cross the finish line to recovery. So there you have it. From the starting line of diagnosis to the finish line of recovery, omeprazole is the steady pace setter in the race against gastric ulcers. With proper treatment, most horses can recover fully within 4 weeks. Prevention is always better than cure, especially when it comes to gastric ulcers in horses. It's a sentiment most of us can agree with. So let's delve into the various management techniques that can help in preventing ulcers. Firstly, feeding horses frequently or allowing them free choice grazing can be beneficial. Why is this? Well, remember how we mentioned a horse's stomach produces acid continuously, even when they're not eating. By having a steady supply of food, especially roughage like hay, the acid is effectively buffered, reducing the chances of ulcer formation. Next, let's talk about diet. Reducing the amount of grain and concentrates in your horse's diet can help prevent ulcers. This is because grains can increase acidity in the stomach. Instead, consider adding alfalfa hay to their diet. Alfalfa is high in calcium and protein, which are both natural acid buffers. Now, let's move on to medication. If your horse needs anti-inflammatory drugs, try to avoid or decrease their usage. These drugs can disrupt the protective mucus layer in the horse's stomach, making it more susceptible to ulcers. If they must be given, opt for safer alternatives such as firocoxib. Stress is another contributing factor to ulcer development. Try to limit stressful situations such as intense training and frequent transporting. If your horse must be stalled, create an environment that allows them to see and socialize with other horses and have constant access to forage. This mimics their natural grazing and social behavior, reducing stress levels. Water intake is another crucial element. Ensure your horse has constant access to clean, fresh water. Dehydration can increase the risk of gastric ulcers. By following these guidelines, you're not just mitigating the risk of ulcers, but also promoting overall well-being. It's about creating a lifestyle that aligns as closely as possible with the horse's natural behaviors and needs. To sum up, prevention of gastric ulcers involves frequent feeding, a balanced diet low in grains, limited use of certain medications, stress management, and constant access to water. Implementing these preventative measures can significantly reduce the risk of your horse developing gastric ulcers. If you found this video to this point helpful or interesting, show some appreciation by hitting the like button and subscribing for more. This helps us a lot so we can make more informative videos about horses. In addition to management changes, certain supplements and herbs can also help prevent gastric ulcers. Firstly, let's discuss aloe vera, a plant known for its soothing properties. Aloe vera juice can play a significant role in your horse's diet as it helps soothe the lining of the stomach and reduce inflammation. This is due to its active components that have been proven to have remarkable anti-inflammatory and healing properties. Alongside this, aloe vera juice also contains 7 of the 8 essential amino acids that the horse's body cannot produce on its own, making it a great supplement. It can be added directly to the horse's food or water, making it an easy supplement to incorporate. Next, there's beetroot. This vegetable is high in fiber, which can help buffer stomach acid and reduce the risk of ulcers. Beetroot is packed with vitamins and minerals. It's particularly high in folate and manganese, both of which are essential to a horse's good health. Furthermore, the fiber content in beetroot aids in digestion, helping horses process their food more effectively, while also reducing the risk of constipation. Another advantage of beetroot is its natural sweetness. This makes it a hit with horses, meaning you'll have no trouble getting them to consume it. You can serve it raw or as dried chips, whatever your horse prefers. Lastly, we have methyl sulfonyl methane, or MSM, a popular supplement in the equine world. MSM is a form of sulfur, an element that is essential for the health of a horse's joints, skin, coat, and hooves. But it's not just good for external health. Internally, MSM's anti-inflammatory properties help protect the stomach lining from gastric ulcers. It helps to detoxify the body and speed up recovery from any inflammation. MSM is typically available in a powder or pellet form and can be easily mixed into your horse's food. These 3 supplements, combined with proper management, can greatly help manage and prevent gastric ulcers, keeping your horse in top shape. There are also some herbs which can be very helpful. Marshmallow. Marshmallow root contains mucilage, a soothing substance that can help coat and protect the digestive tract lining, potentially reducing irritation caused by ulcers. Slippery elm. Slippery elm bark is known for its mucilaginous properties, which can help soothe and protect the gastrointestinal tract. It may aid in reducing irritation and promoting healing of ulcerated tissues. Licorice. Licorice root contains compounds that may help reduce inflammation and promote mucus production, potentially providing relief for ulcer symptoms. However, licorice should be used cautiously and for short durations, as long-term use or high doses can lead to side effects such as electrolyte imbalances. Chamomile. Chamomile has anti-inflammatory and calming properties which may help alleviate discomfort associated with ulcers and support overall digestive health. Meadowsweet. Filipendula ulmaria. Meadowsweet contains salicylates, which are natural compounds with anti-inflammatory properties similar to aspirin. It may help reduce inflammation and discomfort associated with ulcers. Probiotics and prebiotics are increasingly recognized for their potential in managing and preventing ulcers in horses by promoting a healthy gastrointestinal tract. Probiotics are live microorganisms that confer health benefits when consumed in adequate amounts. In horses, probiotics can restore the balance of beneficial bacteria in the gut, which can be disrupted by factors like stress, diet changes, or medications. Strengthen the gut barrier, reducing the risk of harmful substances, irritating the stomach lining and contributing to ulcer formation. Produce short-chain fatty acids that nourish the cells lining the gut, promoting healing and reducing inflammation. Help regulate the immune response in the gut, potentially reducing inflammation associated with ulceration. Prebiotics. Prebiotics are non-digestible fibers that serve as food for beneficial bacteria in the gut. They can stimulate the growth and activity of beneficial bacteria, fostering a healthy balance of microorganisms in the gastrointestinal tract. Enhance the production of short-chain fatty acids, which can support the health and integrity of the gut lining. Improve nutrient absorption and utilization, ensuring horses receive optimal nutrition to support overall health and well-being. And modulate immune function, potentially reducing inflammation and promoting healing in the digestive tract. Combination therapy. Combining probiotics and prebiotics, known as synbiotics, can offer synergistic benefits for ulcer management in horses. By providing both live beneficial microorganisms and the substrates they need to thrive, symbiotics can enhance the effectiveness of each component, supporting a healthy gut microbiome and digestive function. Before incorporating probiotics, prebiotics, or symbiotics into a horse's management plan for ulcers, it's essential to consult with a veterinarian. A veterinarian can provide guidance on selecting the most appropriate products, dosages, and duration of use based on the individual horse's health status, dietary needs, and specific circumstances. Equine gastric ulcer syndrome is a common condition that can greatly impact a horse's health and performance. This condition, marked by sores on the stomach lining, is found in a significant number of horses, with symptoms often subtle or completely unnoticeable. Diagnosis requires a gastric endoscopy, a procedure involving an endoscope to visually examine the stomach surface. While there's only one FDA-approved treatment, omeprazole, it has proven effective in both treating and preventing this condition. Prevention is key, and strategies include frequent feeding, reducing grain and concentrates in the diet, limiting stressful situations, and socializing. In addition, a range of supplements and herbs like aloe vera, beetroot, and probiotics can also be beneficial. With the right knowledge and care, you can ensure your horse remains healthy and free from gastric ulcers. Thanks for watching, and remember, a healthy horse is a happy horse.